Hi there, we'll call the meeting to order, and we will start with the land acknowledgement statement. We acknowledge that the ground on which we live is the traditional territory of Caldwell First Nation, of the Three Fires Confederacy, and the original people of Point Pelee and Pelee Island, and its surrounding lands and waters, and that of the Huron-Wendat and Wyandot peoples. We recognize and respect the First Nations who are stewards of the land and waters of Turtle Island, and who have embraced this stewardship since time immemorial. We would also like to acknowledge the contributions of other nearby First Nation communities and all original people across Turtle Island. Can I get an adoption of the agenda from September 7th? Adoption of the agenda. Thank you, Terry and Cindy. And then we will go to C, disclosures. Are there any disclosures of pecuniary interest? No? Okay, seeing none. Can I get an adoption of the minutes from the accessibility meeting on August 14th, 2025? Okay, thank you. Joanna and Cindy. And we will start with our presentation. So today we have Marla Jackson, Director of Client Services from the John McGivney Children's Center, to provide information of the center's programs. So thank you, Marla, and we welcome you here.
How's that? Good afternoon, everyone. Thank you for having me here. Can I just confirm how much time we have to? Not too sure.
Hi, Marla. Usually under the procedure bylaw, you have about 10 minutes to speak, but it's up to the chair, if you go a little bit longer, okay? Thanks.
Sorry, how's that? Yeah. So again, thank you for having me here. I am Marla. I'm from the John McGivney Children's Center. I am the Director of Client Services. I've been there going on about 3 years. It's a really special place in our community, so I appreciate you inviting us to come and share with you what we do. There is a slide deck that you can see. So if you want to flip, the first slide is just a really broad overview of basically everything that we do. I'm going to go through it one by one, but I did just put this in case you ever want to use a one slide placeholder. So on the broadest point, we work with children and youth in Windsor-Essex. So we cover the entire community of Windsor-Essex County. We work from birth to age 19, 21 if the youth are still in school. We can continue to provide services. Some families we work with throughout that entire spectrum. Some families we see 1 or 2 times and support them, provide for their needs, and move on or connect them with other resources. We've been open since 1978 in our community, and we're predominantly funded through the Ministry of Children, Community, and Social Services. We do, however, rely on other funding, other pockets of funding through either grants or special project funding from our ministry or others. And we, of course, rely on generous donors throughout our community to support the work that we do. We see about 4,000 children a year come through our doors, up to of 40 to 50,000 visits a year. I'll talk to you a little bit about where we see the kids and who we provide services for. If you want to flip to the next slide. We provide core services, so these are what we call our base or our core services. This is what we're funded to provide through the ministry. We provide these services in our center. We provide them at about over 100 community schools, and we provide them in the home and or at private schools. Folks that are homeschooled, they're eligible for all of these MCCSS funded services. The 3 main types of services we provide are occupational, physio, and speech therapy. So again, anyone can come to our center and receive some of these services, but we are out, mostly our OT and speech are out providing services in almost every school in our region. Last count, it was about 123 schools, I believe, we have staff out providing. So you can see the types of services that go under each of these. A child coming through the school system is generally referred through their school Sometimes, for example, through the speech-language pathologist that is in the school, they handle a certain type of need within the school system. If they meet a criteria to be referred to us, it would be the actual school SLP or the school board SLP that would refer into John McGivney. Occupational therapy, they actually provide service across almost every classroom. So they are helping at the classroom level, and then they may be helping at a group or an individual level as well for things like, schoolwork, eating, using scissors, using tools, etc. That would be our OT out in the schools, working with the teachers, working with EAs. They help with all equipment, so if children are using any sort of equipment to support their time at school, they would be training staff on that, they would be dispensing the equipment, they would be checking the equipment, etc. Okay? Physiotherapists go out less in the school, but they may go out if a child is either recovering from surgery or requires some specific accommodation in the school setting. They may go out and do an assessment, but they don't do physiotherapy in the school system. That would largely be done at our center. So those are our core services. And again, they start at baby. So all of the preschool gang comes to our center, or we go see them at the home. And then at the school age, we largely see them in the school setting. So we have a supportive, if you flip to the next slide. If you are a family who's connected with JMCC through one of those services, we have all of these supportive services. So we have a social work team. They help with all the funding applications, they help with service navigation, and they might do some brief supportive counseling, largely related to, my child has a new diagnosis, or my child is getting ready to go through a big surgery, those kinds of things. We do a lot of transition planning and life skills planning, so we have transition to school work, so a child who is with us in primary or in preschool, they would be transitioned with our staff, and we would meet with the school system that they're going into. We also have transition to adulthood and life skills training for folks that are trying to figure out either what to do after high school, or how do they learn basic life skills. We do have a very neat seating and mobility workshop right in our center. If you haven't been there, it's very, very cool. They do custom fabrication of seating and mobility solutions for all of our kids. They go to houses, they go to all the schools and make sure that they're comfortable and have the best degree of mobility that they can. We also use a lot of technology to support communication, so we dispense and train and use all of the augmentative communication tools. So you can imagine iPads, or anybody who's who is nonverbal, we often work with them and their teachers and EAs to help them learn how to communicate using technology. We do have a great recreation therapy program. The crown of that is we run a summer camp, a 6-week summer camp for kids that cannot go to summer camp at other places. They are nurse supported largely and have a much higher sort of ratio of counselors to campers, and we provide a safe but recreational supportive environment for these families. We run an infant hearing program, and we've just recently purchased an audiology booth and are starting to stand up our audiology services. Prior, our kids would often have to go to London or Chatham for those. And we do a lot of educational workshops, as you can imagine. So a lot of events and activities and, funding workshops and things like that throughout our center. So if you're a JMCC client, you are referred to all of those and you have access to all of those services. If you want to go on, we also provide, in partnership with TVCC, which is Thames Valley Community Center, and Connections, we provide some autism programming in our region. So I won't look at those, or I won't talk to you about those programs in detail, except to say the one we directly offer is called the Entry to School program, which we're really proud of. This program is for preschoolers with an autism diagnosis, and they come to us. It's a 12-month program. They are in a classroom environment with us, with, of course, a much higher level of support. And we're basically helping them to get ready to transition into school, and then we support them for the first 6 months that they're in a community school with our assistance in transitioning with behavioral plans, etc. So that's programs we've been running for about 3 years. and with great success. Almost all of our kids graduate and go on to community school. If you want to keep going. We have a lot of partnerships where we offer specialized medical clinics to our families. A lot of these are bringing in specialists either from London or Toronto that will come down, for example, once a month and save the trips for our families up and down the 401. Some are physicians that just find it easier, or families find it easier to come and be seen in our center with all of the supports and the family-friendly environment that we offer. So I'll show you, those are all different physicians and or nurse practitioners or teams that come in and run these clinics. So we have a series of clinics that run all month long, every month. The Cleft Lip and Palate Clinic and Dental Program is a provincially funded program. We are one of 2 CTCs across the province that runs this program. So we have a very sophisticated, well-staffed program for kids that are often diagnosed in utero, and we pick them up then and we work with that family until they're almost adults through their entire cleft lip journey. Okay. So that program is often run out of hospitals. Here in Windsor, we do it in partnership with Windsor Regional, but it's run out of our CTC. One more slide, please. We focus on family and youth engagement. We have a lot of activities and opportunities for families to be engaged. A lot of our families are with us for a very long time, as I mentioned. We do have a family and youth advisory council. We have a paid family engagement consultant who provides us with about 15 hours a week and offers all sorts of linkages to our families and sits on our quality council, for example. So we've really focused hard on engaging our families and making sure our services are really meeting their needs. With our generous donors, we run a family support fund, which is helping. Obviously, having a child with disability can be very, very expensive, and a lot of things are not covered. So we run a very successful family support fund. I just ran the stats for our Q1. We did about 34 awards where they apply for either funding for a piece of equipment or something that they need to live a better life, and our support fund will fund it. We also on site have a family resource center and a toy lending library that are staffed by volunteers, which is great. One last thing, because I'm almost out of time. We also are the Smart Start Hub for the region. So in partnership with several other community partners, including Public Health and Children First and Connections and Family Respite, we are the front door for children's developmental services. So we launched this about 3 years ago, and so if a physician, a community member, a partner doesn't know where to send their child, they don't know what the issue is, they need assessments, they need support, they need navigation, we have a one-stop sort of front door where they can come in, they're automatically linked with our service navigator, and they'll help them get connected to where they need. So it's a one-stop number. If you want to go to the next slide, referrals can be made through the school, as I mentioned, with some parameters. Families can self-refer. There's no wrong door. They can refer for anything, and they'll be connected with either our service navigator or directly with a provider. Or a physician, a community member, another agency can make the referral. Our referrals are all done online, and we, like I said, we have the Smart Start Hub front door that can help people navigate, which can be a really confusing system. That's us. Thank you.
Thank you
That
so
was
much. Did you need a few more minutes to?
No, it's a lot. If there's any questions, I'm happy
Yep.
to answer. But
Thank you so much for your presentation. I
course.
will bring it back to the committee to see if there's any questions or comments. And I do want to recognize that Mike is on Zoom as well in our meeting.
Okay.
So are there any questions, comments? Go ahead, Councillor Burns.
Through the chair. A lot of these children are challenged, and how do you work with them to get employment? Obviously, they're not going to go to university, probably will not complete grade
Yep.
12, but I'm looking like, how do you direct the parents and the training for the young adult to actually get a job?
It's a great question.
Do you have any
Yeah.
mentorships with different businesses?
Yeah, it's a great question. Thank you. We do a couple of things. We actually start very formally, reaching out to families when their child, if not younger, at least by the time they're 15, 16, and we start doing what we call transition planning. They're assigned a social worker who is skilled at transition planning. We do medical transition, so we work with, because leaving the pediatric healthcare system can be quite difficult as well and traumatic. And it's very different, so learning how to navigate the adult systems is difficult, so we support with that. We do and have run in the past, I don't have it on here specifically. Part of that would be sort of working out, are you going to university, college, trade, like any school? Do you want to do any specific placements? Do you want to go to university? What do you need to be able to make we'll make all of those connections, up to and including helping with applications, et cetera. If they're looking for a job, we have done a transition to employment program in the past. We did it in the summer. We hire people directly, so we just had two placements over the summer while we've hired folks, and we look to our partners to hire and place folks that are interested in getting some I guess placement experience in a supportive way. But then they also do things like help with resume creation. They do mock resume or mock interviews. So they do a sort of transition to employment program. We've put that on hold for the time being due to some limited resources, but we do understand it's a very, very important piece. Yeah, we had trouble finding placements, to be frank. So it's a lot of work. We understand why it's important, and we'll continue to look for resources to support that piece of work.
Well,
Yeah.
I know some people have gone through your programming and they found gainful employee, and it's,
Nice.
well, they're autistic, but they're very unique people that you give orders to or directions to. They follow it well, and usually they never miss work.
Yeah.
They're there on time, and it's kind of interesting the skills they have. Like a friend of mine named Jack, he'd ask you your birthday one time only. 20 years later, he can tell you what your birthday is by your name.
Right.
Don't ask me how he does it.
Right.
You say your name, and he'll say, like, Terry, oh yeah, July 27th, 46.
Right.
That's his little unique thing he does,
Yeah,
but
yeah. Yep.
it's amazing.
Amazing.
So
Yeah.
thank you for your efforts. I certainly,
Yeah.
I think LaSalle appreciates what you're doing as well as all Essex County.
Terry, I can jump in here as well. So first, I'm Mike. I represent Autism Ontario, specifically working with core clinical funding
Okay.
through Access OAP.
Sorry, I skipped right over your programming.
Yes, so we're very familiar with the programming with each other. And the first thing I'll say is, especially Southern Ontario, there's a lot of agencies with bad reputations or, not the greatest service delivery. And every family I've spoken to that has gone through the services with you guys has had nothing but exceptional things to say. So you guys are seriously a gem within our community. So I really appreciate
you.
that.
Thank you. I feel the same way.
Second thing, just specifically to transition planning, Autism Ontario runs some Journey to Adulthood resource programming. It's a 6-week program, and part of that is employment. So on the French side, I facilitate Journey to Adulthood for specifically youth transitioning to adulthood. So within that, we go over all of the different resources and different agencies available to help. Aid Canada, March of Dimes, Employment Works, obviously, Access Employment. Government of Canada has, youth jobs and all sorts of different resources there. Autism Alliance of Canada, there's probably 40 agencies, but through the Autism Ontario website, there's a ton of those available. So if ever you are looking for those resources,
Okay.
there is a whole series there to help families with that transition, specifically housing, funding, mental health,
Right.
employment, education. So
Wonderful. Okay.
yeah.
Great. Thank you.
Thank you. Are there any other comments or questions? No? Okay, so at this time, I just want to thank you for attending today.
Thank you.
And thank you to you and your wonderful staff for all the wide variety of services that you do offer at John McGivney. So we thank you for what you do for our community. So
Thank you.
Thank you.
I'd also like to invite all of you for a tour. Anybody who wants to come in, it's an amazing space. Our accessible playground is second to none that we share with Hotel du Grace. So if you would ever like to look around, please come and give me a call. We have professional tour guides.
Wonderful.
Our volunteers that love to show folks around, so.
Absolutely, we would love that. So
Thank
we'll,
you.
we'll arrange that for sure
Yeah,
for the
link up
committee
with Mayor
to take
Kathy.
a tour. Thank you so much for attending
Thanks.
today.
Thanks for having us.
Thank you. Okay. At this time, we have items for consideration. We will have Scott Bisson, Manager of Culture and Recreation, will present a report to us.
Thank you, Madam Chair, and to the rest of the committee. This report is a brief report post-Strawberry Festival, and you may recall a couple years ago, we did a similar report to the Accessibility Advisory Committee, just sharing some improvements we were trying to make to improve or remove some physical barriers for guests to the Strawberry Festival. Our Strawberry Festival this past year was, pretty successful. I think we had just nearly 29,000 people, which was slightly down, but of course it did rain on Thursday night and was quite cold, and really the difference between the attendance from 2024 to 2025 was that difference on Thursday. So overall, it was a successful festival. What I was bringing forward to the committee just to share is 2 years ago, it was noted in a previous festival that we were using large rubber matting to cover cords that ran across the pathways that the public would be using within Lot 3 of the festival. And of course, if those get wet, they get slippery. They're large and cumbersome and hard to maneuver over. So we had made some improvements by eliminating those and getting specialized cable covers that were more high visibility and also were a little bit easier to maneuver, but they still were a barrier. Since then, we found that there was conduit that ran from the exterior power boxes outside of parking lot 3, where we access all the power. And those conduits ran under the parking lot and to the light poles in the middle of the parking lot. So working with our electrical contractor, we were able to have some power run from those boxes under to those light poles so that the vendors that were in the middle of that parking lot could access power from the middle poles. And therefore, we were able to remove those cords running across the parking lot from the exterior boxes to where the vendors were located. So I just wanted to bring this back to the committee and say that we, are continuing to look at ways to improve the accessibility of the festival. Certainly, a lot of the improvements I've made, I guess, over the last couple of years have been removing physical barriers, and with the presentation that we just heard, I think there's opportunities for us to continue to look at ways to improve accessibility outside of just physical barrier removal. And we will certainly continue to look at those and are open to suggestions that we get from the public. But this report was just really to bring that to your attention, that work was done. And we're constantly looking, I guess, for ways to continue to improve the accessibility of the festival. And with that, I'm available for any questions.
Thank you. Are there any questions at this time or comments? No? Okay. So the recommendation is for the 2025 Strawberry Festival post-festival update. Recommendation is that the report of the Manager of Culture and Recreation dated August 29th, 2025, CR 2025-24, regarding 2025 Strawberry Festival post-festival update be received. Okay, Councillor Burns and Cynthia, all in favor? Okay, that goes, okay. Questions and statements from members of the committee? Okay, Councillor Burns.
Yes, I attended as well as the chairman, Rita, and the mayor to Accessibility Day, was it, in Amherstburg. Was pretty interesting. Was great to see our crew there. I think they did a great job. I don't know who's in charge of that, but Colin, you could give that back to administration. And, as you go around, you learn a lot of different services I would never have thought were available. So their Field of Dreams was outstanding. They had a ball game there as well. And certainly a lot of people there with disabilities that were brought out to see, and they seemed to enjoy their day. And you couldn't have asked for a better, pleasant day in 75 to 80. It was just wonderful. So Thank you, Anita, for reminding me on that too, because I would have forgotten. That's all I have to report.
Are there any other questions or comments? Oh, go ahead.
The only question, I guess, or comment I have is, would they look at doing a different day for that Accessibility Fest next year? Because the kids are in school, so they're not able to attend, but this Friday there's a PD day, so a week later, you'd have more kids have the opportunity to go check out what's going on, see the baseball field, see the sledge hockey demonstration.
Thank you. Linda has noted that, and perhaps we can have that discussion with the committees and to see, bring your suggestion forward. And hopefully, that's a great point. It's a great idea to have the students to be able to attend because there were some wonderful activities and resources there. So thank you for that. Okay, so I would also like to say something too. So I did attend as well with Councillor Burns, and Mayor Meloche was there, and we had some of our wonderful, oh my gosh, wonderful staff that represented the town of LaSalle, and it was a beautiful day. It was wonderful to see the baseball game. I really enjoy seeing the Miracle League and how they engage and have a wonderful time there. And just to see the amount of resource tables that were there from different community partners, it was just something really, really nice to see. And myself and Mayor Meloche and Councillor Burns were able to speak to some other representatives from different organizations. And it was just really nice to see that it was that engaged and that the people that were in attendance really brought home some great resources that they didn't even otherwise know about. So yeah, it was definitely great. And I'd like to thank our staff for attending and for all of your hard work. Emily and all of the rest of your crew for attending. It was greatly done, and we appreciate you at the town. And Emily, if you wanted to say a few words as well.
All right, thank you so much. I'm going to reiterate just a little bit of what was already said, because I do share a lot of the sentiments that were expressed about the ability for all these different community organizations to come together and really share this wonderful information about accessibility and inclusivity. So we actually had members from our council services team, we had culture and recreation, as well as strategy and engagement that were all staffed at our table throughout the day. We did have a booth at the Accessibility Fest for All, and we were able to provide some different sensory promotional town items to the passerbys as they came and asked us some questions, especially about our programming and our accessible trails. So it was a wonderful event. And some of the information that you had mentioned here regarding the date of the event, I believe that was mentioned in a suggestion comment out to the county, because that was something we were wondering about too. There's so many great organizations and vendors there that families could have definitely benefited from that information, but maybe because of a work schedule or the family's children being in school, they weren't able to attend. But we'll see what happens with the county. They seem receptive on some of our ideas, so we'll look forward to hearing more about that in the future.
Thank you very much. So our next meeting is scheduled on November 19th at 3:30 p.m. Please note that it will be at the Fire Hall Station 2 at 2190 Front Road, and there will be a reminder email sent as well. So this will be our time to adjourn. So thank you very much for attending.
Thanks, everyone. Take care.